Hello everyone. Welcome again to IPGASF tutorial videos.
Welcome to understanding of important reasons of pharmacology. Why tetracyclines are contraindicated in pregnant women and children. Tetracyclines are teratogenic drugs and cross the placental barrier when taken by pregnant females. It complexes the calcium and makes it unavailable for fetal development, which results in bone deformity, staining of teeth, etc. Tetracycline, if taken by children, leads to bone deformity and affect the overall skeletal growth. It affects the deciduous and permanent teeth formation in children. Why penicillin is a life-saving as well as life-threatening drug. Penicillin is an antibiotic used in different diseases like syphilis, gonorrhea, diphtheria, gangrene, tetanus, meningitis, etc. Thus it is a life-saving drug. Penicillin in therapeutic dose, if randomly administered by parenteral route to an individual without checking its allergy, then it may produce severe allergic reactions such as anaphylactic shock. Hence it is a life-threatening drug. Why sulfa combinations are preferred over single sulfa drug. Combined drug treatment gives synergistic effect.
Combination reduces chance of crystalluria and hematuria.
To produce additive effect and less irritant effect. Why adrenaline is always present in the emergency kit of the physician. It is because adrenaline is a life-saving drug. It is the drug of choice in following clinical conditions: anaphylactic shock, cardiac arrest, asthma. Why acetylcholine is not used clinically. ACH acts on all cholinergic sites throughout the body. When given orally, it is rapidly hydrolyzed in GIT. On IV administration, it has no appreciable actions because considerable amount is destroyed by pseudocholinesterase at the site of action. Thus ACH has very short duration of action, and hence, acetylcholine is not used clinically. Why insulin is not given orally. Insulin is a polypeptide hormone secreted by beta cells of islets Langerhans of pancreas. Commercially, it is extracted from pancreas of cattle or pigs. When given orally, proteolytic enzymes and gastric juice, HCl, causes its degradation and therapeutic effect is lost. Why cheese and butter is contraindicated during MAO inhibitor therapy. Cheese and butter contains tyramine. Tyramine is metabolized in the liver by the enzyme monoamine oxidase. During MAO therapy, the MAO inhibitors inhibit the detoxification or metabolism of tyramine. Thus tyramine is not metabolized and thus gets accumulated in the body. This tyramine causes the release of noradrenaline from its binding sites. Increased level of noradrenaline causes hypertensive crisis. Why large amount of fluids is taken along with the sulfa drugs. Sulfonamides cause renal complications. In presence of acidic urine, the acetylated form of sulfonamides is precipitated in collecting tubules. This causes renal irritation, obstruction of urinary flow. Alkalinization of urine also enhances the urinary excretion of sulfonamides. Hence large amount of fluid intake is required.
Thanks for watching the video. Please like, share and subscribe our channel. Follow us on Facebook, Instagram and Twitter.